history. All assessments involve collecting two kinds of data, objective and subjective. A complete health history. Be sure to include prescription drugs, over the counter drugs, herbal preparations, and vitamins and supplements. Ask about the patient's feelings of safety to help identify physical, psychological, emotional, and sexual abuse issues. Ask about the patient's family medical history, including history of diabetes or heart disease. A complete neurologic examination is long and detailed, and you probably won't perform one in its entirely. However, if your initial screening examination suggests a neurologic problem, you may want to perform a detailed assessment. The levels of neurologic function. When assessing the neurologic system, begin with the highest levels of neurologic function, assessing mental status and speech. A quick check of mental status. To quickly screen a patient for the disordered thought processes, ask these questions. What's your name? This indicates orientation to person. What's your mother's name? This indicates orientation to other people. Where were you born? This indicates remote memory. What did you have for breakfast? This indicates recent memory.
Who is the current US president?
Who's currently the country's president? This indicates general knowledge. Level of consciousness. A patient is alert when the patient follows commands and responds appropriately to stimuli.
Bati ka ron, sir. Tulgon lagi ka, sir.
A patient is lethargic when the patient is drowsy and has delayed responses to verbal stimuli.
Ma'am.
A patient is treacherous when the patient requires vigorous stimulation for a response. A patient is in coma when the patient doesn't respond appropriately to verbal or painful stimuli. Glasgow Coma Scale. A decreased score in one or more of the following categories may signal an impending neurologic crisis. Add the scores for the best response in each category to achieve the total score. A total score of less than 9 indicates severe brain injury. Assessing cranial nerve function. Olfactory nerve. Ask the patient to identify at least two common substances such as coffee and alcohol. Optic nerve. Test visual acuity with a Snellen chart and the Rosenbaum near vision card. Use confrontation to assess visual fields. Then perform an examination of the optic fundi. Oculomotor nerve, trochlear nerve, and abducens nerve. Assess these nerves together using the corneal light reflex test, 6 cardinal positions of gaze, and cover-uncover test. Also, inspect the size, shape, and symmetry of the pupils and pupillary reactions to light. Trigeminal nerve. To assess the sensory component of the trigeminal nerve, ask the patient to close his eyes and then touch him with a wisp of cotton on his forehead, cheek, and jaw on each side. Next, test pain perception by touching the tip of a safety pin to the same 3 areas. Ask the patient to describe and compare both sensations. To test the motor component, ask the patient to clench his teeth while you palpate the temporal and masseter muscles. Note the strength of the muscle contraction and it should be equal bilaterally. Then test the corneal reflex. Facial nerve. To assess the sensory component, test taste by placing items with various tastes on the anterior portion of the patient's tongue. For example, sugar tastes sweet, salt tastes salty, lemon juice tastes sour, and coffee tastes bitter. Test motor function of the facial nerve by observing the patient's face for symmetry at rest and while he smiles, frowns, and raises his eyebrows.
Then have the patient close both eyes tightly. Test muscle strength by attempting to open his eyes.
Acoustic nerve. To assess this nerve, use Weber's test and the Rhine test. Glossopharyngeal nerve and vagus nerve. The glossopharyngeal nerve and the vagus nerve are tested together because their innervation overlaps in the pharynx. Listen to the patient's voice. Then check his gag reflex by touching the tip of a tongue blade against his posterior pharynx and asking him to open wide and say ah. Then, watch for the symmetrical upward movement of the soft palate and uvula and for the midline position of the uvula. Spinal accessory nerve. Assess the spinal accessory nerve by testing the strength of the sternocleidomastoid muscles and the upper portion of the trapezius muscle. In testing muscle strength, place your palm against the patient's cheek. Ask the patient to turn his head against your resistance. Then, place your hands on the patient's shoulder and ask him to shrug his shoulders against your resistance. Then repeat each test on the other side, comparing muscle strength. Hypoglossal nerve. Observe the patient's tongue for symmetry. The tongue should be midline, without tremors or fasciculations. Test tongue strength by asking the patient to push his tongue against his cheek as you apply resistance.
Assessing sensory function.
Pain. Have the patient close his eyes, then touch all the major dermatomes. First with the sharp end of a safety pin and then with the dull end. Proceed in this order: fingers, shoulders, toes, thighs, and trunk. To test for the sense of light touch, have the patient close his eyes, then touch all the major dermatomes, and use a whisk of cotton. To test the sense of vibration, apply a vibrating tuning fork over bony prominences while the patient keeps his eyes closed. In assessing position sense, ask the patient to close his eyes, then grasp the sides of his big toe, move the toe up and down, and ask him what position it's in. To test the patient's upper extremities, grasp the size of his index finger and move it back and forth. Assessing discrimination. Ask the patient to close his eyes and open his hand. Place a common object in his hand and ask him to identify it.
Assessing motor function. Test muscle tone by passive ROM exercises for upper extremities and lower extremities.
Muscle strength. Observe the patient's gait and motor activities, then ask him to move major muscles and muscle groups against resistance.
In cerebellar testing, look at the patient's coordination and balance. Assessing reflexes. Achilles reflex, biceps reflex, brachioradialis reflex, patellar reflex, triceps reflex, superficial reflex, plantar reflex.
Primitive reflexes are abnormal in an adult but normal in an infant whose CNS is immature.
Glabellar reflex, a blink response upon a gentle tapping above the nasal bridge. Snout reflex, pouting of lips elicited by a light tap on closed lips near the midline. Rooting reflex, turning head and mouth towards finger stroking the cheeks laterally. Sucking reflex, instinctively suck vigorously at anything touching roof of mouth.
Once again, a complete neurologic examination is long and detailed, and you probably won't perform one in its entirety.
Shout to all my lost boys. Shout, 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 shout.